This is our applied physiology presentation. My name is Birkan Gündüz, student number GUN 17006641.
I'm Carl Winter, student number WIN16003628.
I'm Joe Nevison, NEV 16004067.
Steroids were developed in the 1930s to cure hypogonadism. This is when not enough testosterone is produced. This was later discovered that it stimulates muscle growth as well. Obviously, with steroids, training is also needed to benefit from them, so bodybuilders and weightlifters will use this drug. Weightlifters will use this drug as it will increase the overall muscle and also increase their recovery. Due to it supplying the body with extra testosterone, it promotes growth and repair of muscles, so they can lift heavier as the higher muscle mass will mean the contractions are stronger, therefore leading to the weightlifters lifting heavier than his/her opponents. The recovery is also important as it means that they can train more often, which will also increase their strength and further improve their personal bests. Males and females react to this differently. Males will have hair loss, small testicles, reduced sperm count, and chances of becoming fertile. They also have psychological effects such as aggression, paranoia, and hallucinations. If you do steroids when you're younger, it could stop your growth. Females, however, will have a deeper voice, male-like features, irregular menstrual cycles, enlargement of the clitoris, reduced breast size, and facial and body hair. There are numerous amount of side effects for this, such as liver and kidney tumours, high blood pressure, severe acne, trembling, severe joint pain, and increased risk of cancer. There are some positives and negatives of steroids. The positives are enhanced muscle strength, which means that they can lift heavier and therefore beat their opponents when it comes to weightlifting. It will also increase their recovery rate, which means that they have more training, which means that they can work on their personal bests and also get stronger. And it can also increase their body frame, which is good for bodybuilders, as it will make them look more aesthetically pleasing, giving them a higher chance of winning their competitions. The negatives, however, are behavioural changes. This means that they could lose some friendships and some relationships. Overall, could impact their whole social side of their lives, and steroids could really change that. This can make them feel more negative about themselves and maybe reduce their performances, as they'll be too focused about their broken relationships rather than themselves. They'll have health problems such as liver and kidney tumours. Of course, these are potentially life-threatening, and if they do have these tumours, this means that they won't be able to train or compete, which means that they'll have more time out of the sport. And also, it's easy to detect in tests. So, if they do get caught out, they may lose credibility and not be allowed to perform again. And it will just overall just negatively impact their name in the sport.
Next is diuretics. They increase the loss of fluids from body tissues, and they also reduce high blood pressure. They do this by increasing the blood flow and or limiting the reabsorption of electrolytes. This acts upon the kidney to increase the amount of water exerted by our body, and it also increases the rate of urine through a variety of mechanisms and removes sodium and water from the body. The impact of this is that it would reduce the amount of water someone holds, so it will then make them lose weight. This means that if a boxer or mixed martial arts, that if they had a fight coming up, they'd be able to meet a certain weight category, and they'd use this drug to lose water, but not muscle, to ensure that they keep the power and strength they need to hurt their opponents in the fight. The side effects of this is insomnia, chronic fatigue, impaired concentration and attention, and increased chance of illness. The positive of this is that it helps with weight loss. So as I mentioned, with it reducing the amount of water somebody holds, this will drop their weight, so it will benefit them in a lot of fighting sports where they need to meet certain weight categories. It can also help dilute or flush other drugs in the body. So if this athlete was using other kinds of drugs, like maybe stimulants or another kind of drug. This would help them get it out of their system quicker because the water will be flowing itself through, they'll be urinating more, so the drugs can come out at the same time as this. And then it is generally cheap. So for a container of 40, it can be £7.66. So especially for athletes, this shouldn't be a problem as most of them are getting paid high amounts to compete in their sports. The negatives of this is that it can cause dehydration. So obviously for a lot of water leaving the body, there are high levels of dehydration that could occur. And then there could be a loss of concentration. So this can come hand in hand with the dehydration. So if all the water leaving your body, you could become less concentrated on the fight you're performing in, which especially in MMA and boxing, losing concentration can lead to you losing the fight overall. And then muscle cramps as well. So muscle cramps are caused by a lack of water in the muscles. So obviously by the higher levels of water leaving the body, there will be a much higher chance of the muscles cramping up. Again, blood doping. Blood doping requires an athlete to take out their own blood and freeze it, usually for approximately 6 to 8 weeks. This is called homologous. So this basically means when they take their blood and then put their own blood back into themselves. So this blood is then re-injected back into their system. It is done to increase the effectiveness of athletes. So they'll either train at an altitude and take their blood. This will increase the red blood cells, and then so they'll train at altitude and then return to sea level and re-inject the blood that they took out at altitude. Or they quite often take blood from people living in these areas. So an example of this is East Africans are known for having a high red blood cell count. So this is autologous. This is where they take somebody else's blood and then re-inject it back into their system, which is normally seen to be a lot more risky than taking their own blood. The purpose of this is to increase the red blood cell count, which will increase performance by increasing the hemoglobin count and increasing the O2 effectiveness. This mainly prevents fatigue settling in for their long distance events, so this will be more effective in events like cycling, so the Tour de France, or long distance running events. Side effects of this is that there's increased viscosity in the blood, so this basically means the blood is thicker, and this in hand puts more stress on the heart, so it could lead to a heart attack or cardiac arrest. It puts more stress on the heart because the blood is thicker. It means the heart must put a lot more energy and effort into pumping it around the body. So it's basically putting unnecessary stress on the heart. Positives of this is that it's very difficult to detect, especially if you're using your own blood. It's almost impossible to detect because it will just come up in the tests as you having a higher red blood cell count, which can occur naturally through genetics. Looking at Michael Phelps, for example, it's very simple and easy to carry out. It doesn't really require much equipment. You just need the needle and a place to store the blood throughout the weeks. It's no man-made substances, so it's a very natural way of doing it. So you're either using your blood or somebody else's blood, which is produced naturally. The negatives of this is that potential infection if the needle isn't clean or the needle's dirty. So this could lead to all kinds of infections, blood infections. The next negative is that there's a high risk when injecting other people's blood, especially from the high altitude East Africans. You're not sure what sort of infections or diseases or illnesses might be being carried around by them at that specific time. So then sometimes you won't have time to then check the blood before putting it into you. So you'd inject it back into yourself unaware of what you're really injecting into yourself. Lastly, it could lead to a red blood cell deficiency. So your body would get used to having these high amounts of red blood cells. So after the event, once your levels start to drop because you're adapting to the low altitudes, your body could then start struggling with a lack of red blood cells and you could cause a red blood cell deficiency.
Erythropoietin. Erythropoietin, otherly known as EPO, is a hormone produced within the kidneys. Moreover, the drug acts on the bone marrow within an athlete's body. This will further then stimulate the production of the red blood cells, which will help with performance. Furthermore, it is also used to treat anemia for medical conditions. Anemia is where there is a deficiency with red blood cells or hemoglobin within the body, which later causes negative effects to lifestyle and exercise. When it comes to physical activity, EPO aids with performance. This is due to the fact that the drug will enhance the amount of oxygen supplied to the body, approximately 10% rise than what it was before taking the drug. This will mean that the amount of oxygen being transported to the working muscles will mean that the lactic acid will not build up as fast and be prevented more thoroughly and for a longer period of time due to the enhance of oxygen supply. Furthermore, again, it stimulates the reduction of the red blood cells. This will mean that there will be more cells to be provided for the oxygen, in which then it will enhance the likes of VO2 max, meaning again the muscles will obtain more oxygen as it is being transported to the muscles more vigorously. Finally, as it treats anemia, a deficiency in red blood cells or hemoglobin, this means that once treated, the amount of hemoglobin and red blood cells production will rise. This again will allow the red blood cells to transport more oxygen due to the fact there is more hemoglobin to supply the oxygen, which allows a better stand against lactic acid when performing. This will overall affect the athlete positively because they will be able to last longer within the game/fixture without having to rest or be taken off due to injury such as cramp. An example would be in a football game. Due to more oxygen being put to the working muscles by the drug EPO, it will mean that the player will last longer and won't have to be substituted due to the lack of oxygen being supplied. The side effect. The first side effect is that the blood within the body becomes viscous, meaning that the blood flow will decrease in speed. This will mean that the working muscles will not be supplied as fast as with oxygen. This will again mean that lots of lactic acid will build up and may cause injury to the performer whilst performing. Furthermore, viscous blood will negatively affect the overall lifestyle due to the heart will have to pump more vigorously to move the viscous blood, in which this will increase blood pressure and cause the higher likelihood of heart attacks. In addition, lung disease can be a problem as well. This will be because the amount of oxygen the lungs will obtain and transport will decrease, in which it will cause the athlete to struggle to inhale oxygen and use it to help them perform, which will be negative for performance. This is because the amount of energy will not be as high and the amount of oxygen reaching the muscle will be depleted and will cause the athlete to come off and stop performing. The positives are increase in red blood cells, increase in hemoglobin, and it treats anemia. An increase in red blood cells means that the amount of oxygen reaching the working muscles and the organs will increase. This is a positive as it will allow the working muscles to be provided with sufficient oxygen to prevent the buildup of lactic acid to prevent the formation of cramps and other injuries. This is positive as it means that the player will be able to play and take part in physical activity for longer times because of this. The same goes for hemoglobin. Because there is more, it means that it will allow more oxygen to be carried out in the red blood cells because of the enhanced hemoglobin levels. This again will allow the working muscles to obtain vital oxygen more frequently, helping with performance as it will prevent injury and help the player last through the game. Finally, this drug will help cure the likes of anemia. This is where the red blood cells or hemoglobin levels are plundered and aren't much use, allowing the person to have a lack of energy and fatigue far quicker. Having the drug will allow the red blood cell stores to increase again, allowing better performance. The negatives are viscous blood, heart attacks, and dysfunction of bone marrow. Having viscous blood means that the time of the oxygen getting to the working muscles and organs will lessen, which will mean that the lactic acid can build up quicker as enough oxygen is reaching the specific places on time. Furthermore, it can allow a build-up of the arteries, which could cause very high blood pressure and can be dangerous and prone for giving heart attacks. Furthermore, it is bad for the performance, as if the oxygen isn't reaching on time, then it can cause the player to have to be substituted or abandon the game early due to fatigue and injury. Heart attacks are very bad because it can affect you in very bad ways, physically and mentally, because of the fact that it is rare and can cause anxiety in the performer, as they may not want to put too much pressure on the heart again and may stop performing physical activity. Bone marrow dysfunction is negative as it doesn't produce red blood cells. They make too many white blood cells. This means that the performance of the athlete won't be able to obtain and utilize as much oxygen, suggesting that the level of performance will decrease due to many white working muscles not supplied with enough sufficient oxygen. Therefore, this will mean that the performer won't be able to perform at optimal level for the whole fixture and will have consequences such as injury or substitution.